The brain uses creatine for energy just like muscle and bone do. The mechanism seems to have the anti-inflammatory effect. So I think we can all identify, when in university, staying up all night, cramming for midterms, people who work overnight, jet lag comes to mind. But when you're metabolically stressed, that's when creatine seems to come to the rescue. So some of the best lines of evidence are during sleep deprivation, hypoxia, or metabolic stress, such as memory or cognitive effects.
It isn't about being perfect. It's about being better. Hello, my name is Dr. Stephanie Stima, and I host expert discussions with thought leaders in all facets of health, including nutrition, fitness, hormones, stress management, performance, recovery, longevity, health span, and energy production. On this show, we discuss complex science, but then we also alchemize it into actionable, everyday living. The ultimate goal with the show is to assist you in making informed decisions about your health and to catapult you into being the hero in your own life. Hey, Betties, do I have a conversation for you? Get ready for a creatine masterclass with Dr. Darren Candow. So a little bit about Dr. Candow. He is a professor and director of the Aging Muscle and Bone Health Laboratory and director of research for the Athlete Health and Performance Initiative in the Faculty of Kinesiology and Health Studies at the University of Regina, Canada. He has published over 135 peer-refereed journal manuscripts. He serves on the editorial review board for the Journal of International Society of Sports Nutrition, Nutrients, Frontiers, Advanced Exercise and Health Sciences, and is a scientific advisor for ALSCHEM and Create. Very well-established researcher, as you will very quickly see. We talk all about creatine for muscle performance and growth and to get that swole look, that post-exercise pump. We talk about bone health. We talk about performance. We talk about brain health. We talk about perimenopausal women and menopausal women, sleep, body recomping. And then, of course, we talk about all the myths that you have heard about creatine. Does it cause hair loss? Are my kidneys going to shut down? Does it cause cancer? Is it going to cause muscle cramps? Am I going to gain weight on this? Am I going to bloat? All of these things are discussed and with elegance and nuance, as Dr. Candow does. This is going to be excellent for you if you are someone new to creatine or you've been scared, you've heard all these myths about creatine and how it might benefit your performance in the gym and just your enjoyment of life. Because as you know, working out at the gym is not just for working out, it's for getting better at life. So without further delay, please enjoy my conversation with Dr. Darren Candow. All right. Dr. Darren Candow, welcome to The Better Show.
Thanks so much for having me. Absolutely.
I'm so excited that we are having this conversation about creatine. This is so important especially for the demographic that listens to this show. We have perimenopausal, menopausal women. So we're going to do a bit of a masterclass today on creatine, and we're going to talk about myths, benefits, how we can use it as women, what are some of the things that we want to be considering. But first, before we kind of get in there, let's talk about what this molecule is. What is creatine? Where do we find it? Inside the body, outside the body? And what are some of the, we can talk about how it's used.
Yeah, it's a molecule that's very similar to amino acids. Most people are very familiar with protein, but we naturally are synthesizing it in our body in reactions involving amino acids in the liver and the brain. And we're doing that on a 24-hour basis. But we can also consume this molecule in our diet, but this is a caveat. It's only primarily found in animals, and that would be red meat, seafood, and tracer or smaller amounts in poultry. So we can consume a small amount in the diet. We're naturally synthesizing a small amount. And when you add those two together, on average, they come up to anywhere between 2 to 5 grams. But we also excrete a small amount of creatine in the form of something called creatinine in the urinary system. And we can excrete about 2 to 3 grams of that as well. So on average, depending on your diet, we probably have a net accumulation of anywhere between 2 to 3 grams. I think the high side of 3 grams will be for the carnivore diets. The vegans, of course, are not getting any creatine in their diet, so they're going to be on the low end.
Okay. And the reason for that, I was saying in another take, but I'll repeat it here, is The word creatine, if we think about the root word, comes from Greek kreas, which means
Mhm.
meat. So if you are a vegetarian or a vegan, obviously you're not getting meat in the diet. So this net accumulation of creatine is going to be either zero or maybe potentially even negative, would you say?
That's correct. It's a bit about zero. And the good thing though is when we talk about creatine supplementation, all the reputable companies are vegan based, and that's why it's become such an attractive supplement for all ages across the lifespan. Biological males or females, it doesn't matter. And I'm sure we'll talk about children, pregnancy, all the way up to the elderly today. So it's not just for males in the gym; it's for pretty much everybody. And most people didn't know we're already producing in our body, and that's why I think the safety profile is probably superior to all other ergogenic aids.
Yeah, so contrary to bro science, right? Or the guy at the nutrition store telling you creatine isn't for you, that's incorrect. Okay, so let's talk before we get into some of the benefits as well. I do want to talk about the energy system and how it's actually used in the body. So we're going to talk about muscle and the uptake into muscle, but in particular, we have this phosphocreatine system, which is I'll let you explain it, but what does it do and how does it provide the muscle primarily with this sort of immediate source of energy?
Yeah, when we consume creatine through the diet or supplementation or the creatine release from the liver, it simply enters your bloodstream and then it's taken into your demanding tissues. About 95% is taken into skeletal muscle. The leftover is between the bone, testes, and the brain primarily. But once creatine becomes trapped or inside the cell, it's phosphorylated with a phosphate bond, and then it becomes a larger molecule. Therefore, it can't leave. It can't leak out, so to speak. And once it's in there and trapped, that's a very good thing. If you go all the way back to your high school biology, phosphocreatine is needed to maintain or resynthesize a molecule called ATP or adenosine triphosphate. And everybody listening remembers, oh, ATP is the energy currency of all our cells. Anytime we move, shoveling the driveway in a couple months here in Canada, gardening, playing soccer, or weightlifting, we're using our muscles. And the more muscle activity you use, you put more reliance on ATP, and that's where creatine really comes into play. It sort of sacrifices itself. It donates a phosphate group to maintain the energy currency cell of our molecule. Therefore, if you have more ATP longer, you can exercise longer at a higher capacity.
Okay, great. So let's talk about muscle and let's talk about some of the benefits around it. So we have in the muscle, there are different types of muscle. There's slow twitch, fast twitch, or type 1, type 2. Is there a preferential uptake between type 1 and type 2 fibers that take up creatine?
There is. So type 2 or large muscle fibers, we use those during a leg press or a bench press, and those have preferential uptake and storing capacity. So type 2 muscle fibers have the largest storing capacity of creatine compared to type 1 muscle fibers. So anybody involved in high performance anaerobic type of sports will be relying more on type 2 muscle fibers when you're doing repetitions to fatigue or something very, very powerful. And that's where creatine really comes into play. So of all three of the energy systems, creatine seems to have the greatest predominance in the anaerobic alactic system. Or think of the energy system you use in the first 10 seconds of an explosive sprint, or maybe the first 6 or 7 repetitions of a heavy squat. You really need a lot of energy. You're recruiting those type 2 muscle fibers. And ironically, those are the muscle fibers we start to lose in the fourth decade leading on, and that's referred to as sarcopenia. We preserve these type 1 muscle fibers. Those are the ones you use walking, maybe light activities, but explosive activities, type 2 muscle fibers. And unfortunately, they are reduced with aging. And that's why we think aging individuals may need a bit more creatine to offset the rate of loss.
Right. And this is where resistance training comes in as well, right? Because you are also engaging in this. If you are, let's say you're doing a squat, as you were saying, or a leg press or something, you slow down on that descent and then you can like power up, right? You can have that explosive power to come back up, to stand back up if if you're doing a barbell squat or something. And that is also using this anaerobic system as well. And those primarily those type 2 fibers, correct?
That's correct. Anything that's explosive to you or you're putting in maximal effort would be the anaerobic alactic, and then less reliance on the anaerobic lactic system, which primarily uses carbohydrates for energy. But walking and things like that, you're using the aerobic. So creatine got famous basically for enhancing the anaerobic alactic system, or that system that requires a massive amount of energy or recruitment. And the recruitment is your type 2 muscle fibers.
Right. And it's that first, as you said, it's like the first 10 seconds of a sprint. If you see even like the 100-meter dash, like it's probably all phosphocreatine. If you see the 200-meter, it's like at some point they got to switch that aerobic glycolysis. And then, there's like this sort of biological fork in the road, let's say. So this is why we never miss friends, never let friends miss leg day, right? This is why. Okay.
For many reasons, yes. And the other big one is the biggest muscles are in the below the belly button. Let's put it that way.
Yeah.
And if you do miss leg day, especially as you get older, that is catastrophic. We've shown now that you may need to double the amount of volume in the lower limbs compared to the upper because you're having muscle atrophy. Those type 2 muscle fibers are being compromised. And we've actually shown in a meta-analysis that your phospho-creatine kinetics are sort of more jeopardized in the vastus lateralis or the quadricep muscle compared to the calf. And where are the quadriceps activated? Well, that's sprinting, leg press, squat. Unfortunately, as we get older, we typically refrain from that and do single joint movements, or God forbid, take the escalator or elevator instead of taking the stairs. And I think what we need to start looking at is power training or the ability to maintain activity as we get older. So I use the argument, if you need 3 sets for your bicep and tricep, you may need 6 as we get older for the lower muscle groups just to maintain the rate of loss. And we showed in a classic paper in 2005 that the lower body, unfortunately, as we get older, is more negatively affected than the upper body. So for anybody listening in the 4th decade or above, if you have the ability to activate your leg muscles, please do so and do so very often.
Yeah, this was one of the tests that we did in the clinic all the time. It was like, wall sit. What's your number on wall sit? And then can you get up? If we had a geriatric patient, it was like, can you get up from the chair without holding on to anything? If you can do that, can you get up off the floor without holding on to anything or using your hands? And then if you could do that, it's like, can you lie on your back and get up without using any assistance? It's all your legs, your core, proprioception, balance, all that kind of stuff.
And a really interesting thing, researcher Stu Phillips out of McMaster University and my colleagues, we've done 2 small meta-analysis. And lo and behold, when creatine was combined with resistance training, these individuals got an improvement in gait speed and sit to stand. And this is 2 of the hallmark, as you just mentioned, that we sort of assess functionality. And interestingly enough, from a global perspective, functionality is now sort of housed in with muscle mass and strength to diagnose sarcopenia. So I think it's something that was often overlooked, but now there is a good focal point, which is very advantageous.
And so this is for, the nerds that are listening, and just for my own nerdy inquiry, so the mechanism of creatine supplementation, is it when we're preserving the type 2 fibers or adding to it as we age? So my big philosophy is like, you have to keep at least what you got, but ideally add on to it. Is it the sarcomere that's lengthening? Is it the donation of satellite, the transcript? Like what is happening with creatine supplementation that is causing this amplification or this augmented effect with resistance training?
Yeah, the thought is there's about 10 mechanisms that sort of come together. But to your point, the theory with hypertrophy, not hyperplasia, is that sarcomeres do in series. But a paper just came out this year where we think they will now lengthen in parallel so they can get an increase in cross-sectional area and length.
And
therefore the sarcomere, when you flex it, will get healthier from not only a length, but by width perspective. Jose Antonio and Mike Roberts, who is one of the best researchers in the world at Auburn, they've speculated that hyperplasia probably does exist. We just don't have the technology to look at those muscle fibers splitting. But some of the mechanisms why we think could contribute to that, satellite cells and transcription factors seem to get activated. There's some proteins in the mTOR pathway that have been shown to get upregulated when the cell is swelling. So I think water influx or osmosis could be one of the driving factors from a cellular perspective. We just talked about phosphocreatine. We think that is one of the main reasons people get stronger. Calcium and glycogen is involved there as well. But from an anabolic perspective, we think insulin-like growth factor is also involved there. So there's a whole gamut of factors. But it's important to know creatine has never been shown to directly increase the rates of myofibrillar protein synthesis. So unlike leucine and whey protein, which increases protein synthesis directly, creatine has not been shown that. We think it works in a sort of a multifactorial way to do that. But creatine also has anti-catabolic effects, which I think do contribute to the net anabolic effect. There's good evidence in rodents that it has an anti-inflammatory effect and an anti-catabolic effect from muscle protein breakdown.
Right. So that net protein synthesis is maybe 5%. I don't know what the number might be, but maybe there's a there's going to be more preservation of the net of the muscle protein synthesis than there is degradation.
That's an excellent way to put it. It seems to cause a sort of an anabolic and an anti-catabolic effect. But this is a great question for my students on a multiple choice question, because they think creatine makes the individual bigger. But it's interesting, we've never been able to show it increases muscle protein synthesis directly. Like, if you take a whey protein or casein, it does. But creatine sort of works in a bunch of other ways. There's about 10 purported mechanisms that seem to be very viable. But ironically, the vast majority of these mechanisms have only been shown in younger adults. We still have a long way to go to show that do these satellite cells and IGF-1 and decrease in myostatin, does that happen in older adults? And again, those mechanisms are primarily only in young males. So again, we need to look at the effects of estrogen or progesterone on potentially these effects as well. So I think the focus on creatine will be there for the next few decades, and hopefully we incorporate a lot more females across the lifespan and get more mechanistic data.
Amen. Can I get an amen? It's like always like the university students, like it's the young men in universities that are like signing up because they need to pay for their bills or whatever. That's where so much of our literature is done. So I'm so happy. And you're, one of the leaders, I would say, in the field that is really having this conversation around specifically creatine and the, let's say, the arc of a woman's life, right? So how this changes over the arc of her hormonal life, perimenopause as well. One question I wanted to just come back to, you mentioned water.
Mhm.
Sometimes I'll say maybe, and I oversimplify it, but I will call myself out here. I'll sometimes say something like water is anabolic. Like your muscle cell cannot make new muscle if the cell is dehydrated. And I think one of the, let's say, if we were to sort of nuance that and give a little bit of color to that, part of that is because we are now shuttling in, the creatine will sort of bring water into the myocyte as well. And then that, you had mentioned before, the sort of anti-catabolic effect that can happen. So can you speak a little bit about water? And then maybe we'll take this opportunity to myth bust around water retention, because so many women are like, I don't want to take this because I don't want to be bloated. So let's talk about intramuscular versus subcutaneous water retention.
So the good one is the intramuscular, and as you're correct, when you swell the cell, the cytoplasm enlarges and the cytosol, or that watery medium, where all these organelles are floating around, including the ribosomes, which make our proteins. And the cell really likes an aqueous environment. So if you put more intracellular, or think of inside your bicep, for example, visualize the size of your muscle fibers getting larger, that sort of activates what we think a lot of these processes. So intracellular water retention is fantastic. It's fantastic from many perspectives. And as one of the biggest myths that the myth was that creatine leads to muscle cramping and dehydration. No, it's the opposite. It superhydrates the muscle. So that's a big myth that we've sort of dispelled. From an extracellular perspective, now think of your bloodstream or the number probably going up on the scale. And I would guess this is the number one reason females are very hesitant to take creatine. When they make mistakes with the ingestion of creatine, which I think is really important to talk about, when they do something called the loading phase, it does wreak havoc. So this loading phase is 20 grams a day for about 5 to 7 days. It's very effective for increasing creatine stores in the body. The problem is now you're taking in about 10 times naturally than what we're producing. Creatine is osmotic, and if you go back to high school biology, it's going to have water go from a solvent to the solute area, and therefore you're having more water coming into the body or maintaining the hydration. The research is mixed. Half the studies show that you get an increase in net body water retention, and some show that you don't. I think it has to do with the dosing protocol that you do. But please rest assured, if you go on the scale in the first week and the number has gone up, that probably means an increase in net water retention. It's very unlikely to be body fat. And after about 10 days, those numbers come back to baseline. And I talked about this a few times, that when you measure someone before they take creatine and then measure them after once they stop, the weight may stay the same. But if it did go up, it's probably an increase in lean tissue, which also encompasses water. And we actually now have 2 meta-analyses to show that creatine leads to a very small, but decrease in body fat, which is very advantageous from a global population.
Well, now you have all the ladies listening.
Okay, exactly.
It's like reduction in body fat. Yes, sign me up. Okay, well, back to the loading for a minute. So
Yeah.
20 grams, what would be the justification to do that, if at all, when you can just, I mean, I'll just state my bias. I just take 5 grams, sometimes 10, if I'm traveling, but like 5 basically a day it's like in my morning water, just
Yeah.
kind of do it all the time, whatever, or my morning coffee, which we'll get to there. But what would be the reason why someone would need to load? Like, why does that even exist, the loading phase?
There was two reasons. In 1992, the best study came out showing that 20 grams a day for 7 days was really, really rapid and effective for saturating your muscle stores of creatine. What gets often overlooked, it only took 2 days to really saturate it. So you could do 20 grams a day for about 2 days and feel very confident. So I think it's because it's extremely rapid and people love instantaneous results.
Yeah.
The downfall, though, is I think it's only attractive for Olympic athletes, people competing at the world championships, or where weight fluctuations is not that big of an issue. I never really recommend the loading phase. I'm very similar to you. I would either take a small absolute amount or we base it on the size of the person. So we do 0.1 grams per kilogram. So if you're 70 kilograms, you take 7 grams a day. If a football player is 120 kilograms, they take 12 grams a day. That seems to maintain the sex and the size of the individual. But you can take as little as 3 grams a day and you'll saturate your muscles in as little as a month. So for
Right.
anybody listening and say, hey, I'm not an Olympic athlete, I'm not working out 12 times a week or whichever, I don't think you need the loading phase. I think you can start as little as 3 grams a day, work your way up to what is considered the gold standard, 5 grams a day. Now, that's just from a muscle perspective. Remind me near the end, if we talk about bone and brain, I think there's good evidence to suggest you might need a bit more, not a lot. I mean, when we talk about protein, you're talking maybe hundreds of grams. We're talking at most maybe 10 grams a day. So I think the loading phase is for the athletes. The low dose or the relative dose based on your body size is for everybody else. And the nice thing is it does not lead to net water retention, GI tract irritation, or other side effects. The loading phase is susceptible to some of those side effects.
Well, now that you mentioned bone, let's go there. So, we talked about 5 grams, let's say somewhere like, you said 1 gram per like 1 gram per kilogram of a body weight is usually appropriate, taking into account size and sex and all of that. What if someone, and, maybe the loading phase might be appropriate for someone who's an Olympic athlete or really, concerned about performance. What about the opposite end of the spectrum where we might have someone who's osteopenic or sarcopenic? Would the loading phase be applicable to that population?
Yeah, I would recommend no, because some of the adverse effects that can occur. Now, you
Okay.
could have a counter argument to something I talked about earlier, where as we get older, we theorize that you may need more creatine, and the loading phase could be a really great way to really sort of give them a boost. I'm fine at either, but when we do clinical trials with adults 50 and above, when we do the relative loading or relative dosing period without a loading phase, we don't get any adverse effects, and it is effective. And all the studies that have shown benefits on bone, the interesting thing here is there was no loading phase, and we gave 0.1 all the way up to 0.14 grams, so about 8 to 11 grams a day for consecutively for up to 2 years. And it had some, not a lot, but some bone benefits in postmenopausal females. It sort of decreased the rate of bone mineral loss in the hip, which is really important, especially for both of us being in Canada.
Yeah.
Icy roads coming up. If you fall and suffer a hip fracture, it could be catastrophic. It was interesting, below the knee, not only did it improve muscle density, but it also improved bone area. So think of those muscles that are activated when you fall or when you're jogging or running. So there is some evidence that creatine and exercise, I can't stress this enough, creatine without exercise doesn't really do anything. You need to have the exercise there. There's a lot of studies that don't show a benefit with creatine on bone. And I think for 2 reasons: that we don't think the dose was high enough, or the duration of the study was long enough to see some significant effects on bone. But when you look at the ones that are a year long and 2 years long in a large cohort of postmenopausal females, the lowest dose that has been shown to be effective is about 8 grams. So now you're like, whoa, I thought muscle was, muscle can be 3 to 5 grams. Bone takes a little bit more. And then we'll talk about the brain as well. So I'm like you, I take 10 grams religiously a day. If I'm traveling overseas, I'm very susceptible to jet lag, which we'll talk about. I take 20 grams in that week. So I load even though I might have the most creatine in my cells on the planet. I've been taking creatine for 2 straight decades. I still take a loading phase before I travel to Europe. I find it really helps decrease the fogginess from jet lag.
Well, that's really cool. And I've pulled some of your studies for
Okay.
discussion today around bone specifically because this is for perimenopausal
Mhm.
women. I cannot tell you how many x-rays I have looked at that I see a 35-year-old or 40 osteopenic already, so she has like her bones are gray, so it's like you don't
Yep.
even see the nice cortical bone, the nice white shell and the cancellous bone. You already everything's just kind of shades of gray, right? Not making any reference to the movie. So let's
Okay.
So let's talk a little bit about some of these studies that you've looked at, and we'll make sure that these are linked in the show notes. I've highlighted a couple of your findings, particularly with bone. Creatine supplementation decreased the urinary excretion of type 1 collagen, also increased whole body bone mineral density and lumbar spine bone mineral density. Okay, so this was done in young boys. And then another one to your point around resistance training. So during supervised resistance training, 8 whole body machine exercises and healthy older males decreased bone resorption by 30% compared to non-significant 6% reduction in the placebo group. So let's talk a little bit about bone resorption. So we've talked a lot on the show. My Betties are familiar with the term osteoblast and osteoclast. These are bone builders and bone breakdown, like the bone builders that build up the bone and then the clasts break it down, bone resorption. Talk about how creatine can act as a substrate or fuel source, let's say, for the bone builders, these osteoblastic cells in the skeleton.
Yeah, it was a study that was by accident, kind of. We got bored of muscle, and then a great researcher out of Switzerland said, "Well, bone has transports for creatine just like everything else, and let's put bone building cells in the presence of creatine," and it became activated, very energized. And then immediately the theory was, wow, if we take this to a healthy human population, if our osteoblast cells are more energized, could they lay down more calcium? Could they lay down more phosphate salts in the matrix of the bone?
Mm.
And could the bone actually get an increase in deposition? And then we started to think, wow, what if it has anti-catabolic effects or anti-resorptive effects? And when you look at type 1 collagen, it's a very easy marker to look at. About 30 to 40%, depending on the individual, or collagen is the most abundant protein. It actually showed that you got a reduction in this marker of bone resorption. So for your listeners, very similar to a bisphosphonate, but obviously it's a non-pharmacological intervention. And there's been a few studies to replicate this, that creatine with exercise seems to reduce measures of bone resorption. And then if you put them together, maybe these osteoblasts get more energized. Osteoblasts release a decoy in our cells called osteoprotogerin, which inhibits osteoclasts. So which population would benefit from having an improvement potentially in osteoblast activity and a decrease in resorption? Well, it's anybody on the planet, but primarily more biological females. And we focused on postmenopausal females due to the cessation of estrogen. And that's why that population was sort of targeted. But the few studies that we started with were in healthy males, and even males had a beneficial effect from reducing NTL peptides as well as bone resorption. And that's now been shown in young and older males as well. So it's nice that we have males and females responding from a positive aspect with creatine. Again, there's other studies that don't show the effect, but I think the methodology or differences between the studies has to be considered. But there is evidence to suggest that creatine and exercise can have some muscle preservation effects, if you will, as well as decreasing bone resorption.
Well, in both cases, it's anti-catabolic, right? So, but with the
Catabolic.
yeah, so with the muscle, it's anti-catabolic. It looks like it's the same in terms of like fueling the right bone cell, right? It's like fueling the osteoblast and sort of inhibiting the osteoclast.
Yeah. And I really like your segue. When you talked about the young boys, that study was done at McMaster with Mark Tarnopolsky, and they looked at Duchenne muscular dystrophy, which is highlighted by men in facets. But one of the big things is a decrease in muscle and bone mineral. And it was the only study to show that in a clinical or disease state population, activity and creatine can have some bone building effects, which I think has enormous application. Those studies often get overlooked as justification of why we're trying to do it. So maybe when you take creatine in healthy humans, adequate diet, you may not notice any big bone effects, but in clinical populations, the question still remains. And that's why I'm really intrigued of taking an osteopenic population and osteoporotic and even frailty. maybe this lifestyle intervention of exercise and or creatine can have some more favorable effects. And I see that as being a focal point for the next decade.
Yeah, and unlike the bisphosphonates, you can take it
Mhm.
longer for 5 years, and you're not gonna increase your risk of fracture, which is what happens with when you're on long-term some of these long-term drugs as well. Is there an just sort of kind of a curiosity, Parkinson's, Huntington's disease, do we see any application for creatine there in terms of in terms of the brain centers? We'll talk about brain benefits as well, but just as we know that these are generally muscular atrophy diseases. Do we see any benefit with creatine supplementation there?
Yeah, unfortunately, the best answer is no. There's been a few studies that show some functionality benefits, but the vast majority show no clinical benefits with Parkinson's, Huntington's, ALS, or MS as well. Although creatine was touted to be a neurotransmitter, and there's a lot more evidence that needs to be put into it, we're not seeing any good results there. Muscular dystrophy from a neurophysiological and neuromuscular condition seems to have the best line of evidence. Again, it's only 2 studies, but I know long-term trials need to be done in those areas. But the big area we're really trying to focus in on now is Alzheimer's and dementia. There
Yeah.
is a study, I believe, started in Kansas with Alzheimer's, and then I'm collaborating with researchers in Iowa to look at individuals diagnosed with clinical dementia and to focus on that as well. Great psychiatrists out of Utah are now showing really good benefits on depression and anxiety in cohorts that are on medication with clinical depression. And then when they add creatine to that, they're seeing some promise there. So I think from the neck up, will be a big focal point for the next few decades. We need long-term randomized control trials before we can conclude the benefits. We're not seeing any side effects, which is really promising in any of these short-term trials as well. And in the long-term trials that you just alluded to with the 2 years of creatine, we saw no adverse effects on the kidney or liver compared to placebo. So overall, creatine seems the safety profile is very, very good, and it has a lot of upside to it.
And I apologize for jumping to the pathophysiology right away. It just was a question that came up, but now that we're here, let's talk a little bit about the brain. Mentioned depression and anxiety and Alzheimer's and dementia, but let's talk a little bit about the brain. We know that it makes its own creatine, sort of
Yes.
separate. It's a sort of it's this immunological privileged site. The brain,
Right. Yeah.
blood-brain barrier, and all this. Is the brain resistant to supplementation? Tell us about creatine in the brain.
Yeah, we think it is. So skeletal muscle does not make creatine and it acts as a vacuum. It will suck up all the creatine from your blood that it can. But as you just alluded to, we have to protect the blood-brain barrier, and the brain is resistant to dietary creatine that you're consuming, even the creatine that's made in the liver. And then if you take a supplement, we think it is resistant. There's these thing called astrocytes at the blood-brain barrier. They lack the doorway. Oligodendrocytes have it. So it can get in. It's very, very slow. So we say it's a blunted effect, but that justifies why we think if you're trying to get brain accumulation of creatine, remember, brain is already making its own. It probably says, why would I need a supplement when I'm doing fine, except for when the brain is stressed? So this is really important. Don't let me forget to highlight that.
Okay.
Creatine supplementation can get in, but we think it requires a lot higher dose than muscle or a longer period of supplementation. Because every time you consume creatine, 95% will go to your muscle, some will get excreted. Hopefully, trickle amounts will go to your brain as well as bone. So the best lines of evidence suggest that about 20 grams a day for at least a week is needed to accumulate in the brain.
Oh, there's that loading phase. There's that
Yeah,
loading.
so there's the loading phase. So now it comes down to the question, why are you taking creatine? But there's also good evidence one of the landmark studies showed that 10 grams was a really good dose using MRS to get in the brain, and it was a lot better than 4 to 5 grams. So if you take that 10-gram dose, that seems to be a very effective dose as well. If you want to take that 4 or 5 grams a day, rest assured it's eventually going to accumulate. We showed in long COVID patients, it took about 6 months. It did get in 3, but it was a little bit more. So I guess it comes down to why you're taking it. If it's just from a muscle performance, 3 to 5 grams a day, once or twice a day is plenty. Bone, you may need a bit more. And I'm like you, I take 10 grams a day for the total body, brain, bone, and muscle benefits. And it's because that blood-brain barrier is there. It's very resistant to what gets in, but it's also very protective of what leaves. And this is very interesting. Study out of Brazil showed in vegans and omnivores, the creatine levels in the brain were identical. unlike muscle where vegans were a lot low. So for vegans listening, their brain creatine levels are identical. And then again, this was in a single study, but it was done with MRS, which is an MRI for the brain, showing that the levels were very, very high. And the other thing we're starting to see is that you will only potentially experience cognitive or memory effects when the brain is stressed. The brain uses creatine for energy just like muscle and bone do. The mechanism, it seems to have the anti-inflammatory effects. So I think we can all identify, when in university, staying up all night, cramming for midterms, people who work overnight, jet lag comes to mind. But when you're metabolically stressed, that's when creatine seems to come to the rescue. So some of the best lines of evidence are during sleep deprivation, hypoxia, or metabolic stress, such as memory or cognitive effects.
Well, this is why I wanted to bring this up, because if we think about the perimenopausal and menopausal woman, we do see changes in mood, affect, sleep, which we're going to get to, but depression and anxiety, like suicide ideation. And I don't mean to jump right to but like suicide ideation, anxiety, depression. A woman will go in so often to her primary care physician with some of these, this sort of cluster of symptoms, and she walks out with an antidepressant when maybe, I'm not saying that we won't talk about the monoamine hypothesis now, but I've talked about it on previous, like maybe the antidepressant is a Band-Aid, but maybe sort of one of the underlying issues is that she is metabolically stressed. We do see the change in fat phenotype. We see change in, with her sex hormones declining. We see all of these things happening, metabolic, sex, from a gynecological perspective,
Right.
and maybe what she needs to be doing in addition to the exercise and is making sure that she's supplementing with creatine as well.
Yeah. The thought is that creatine maybe increases brain bioenergetics. So all those clinical issues you talked about, a common denominator is they have reduced brain creatine stores compared to a healthy control. So maybe supplementation just brings those levels back up to normal levels. Or if you take more, it'll get you a slightly higher than the amount. So again, those psychiatrists out of Utah are showing that clinical depressive symptoms are reduced when creatine was added to their normal standard care, including medication. We don't think creatine would ever replace medication, but it has some problems for PTSD, anxiety, and depression. And I think those are the areas we need to add on. In addition, we always measure bone or muscle and lean tissue mass, but I think from the neck up is the area that we really need to start focusing on, not only for postmenopausal females, but for all populations across the lifespan to see some of those cognitive and beneficial effects.
And let's talk a little bit about sleep, since we're talking about the neck up. This is one of the best things you can do for your recovery, for your mood and affect and all that. Is there any evidence to suggest that creatine supplementation can improve any marker of sleep?
Yeah, we actually just published a paper with colleagues in the University out of Idaho, and it's clearly, and this was in young females, which is great. So 5 grams a day combined with a placebo for about 6 weeks increased total sleep duration on the days they perform weight training. So, hey, hats off to weight training. That's a big thing that a lot of people don't do. Before you take any supplement, please exercise. I think that's any physiologist or health care professional would recommend that. And creatine seems to potentially give a little bit greater bang for your dollar there. So that's great. The mechanism, what we think, and I hear this a lot when people say, I take creatine, I don't need as much sleep. Now, one study, as we just showed, say, hey, it improves total sleep duration on the days you work out, maybe because you were fatigued. But the thought is maybe the brain doesn't need as much sleep to recover as much because creatine is sort of coming to its rescue. So maybe that's the mechanism. It has these anti-inflammatory effects. I've seen, and this is anecdotally, but I seem to be able to function pretty well on poor night's sleep in the combination with creatine. I might be biased because I do creatine research, but I really notice the effect. When I fly to Europe, I find my jet lag going and coming is very high. And when I've increased my creatine, it's actually been a lot easier, or the symptoms of jet lag have been a lot easier, especially when I come back to Canada. They usually last a week for me, but I take a high dose of creatine and, of course, like omega-3s and things like that, and it seemed to help. So I'm a big proponent of it. I'm an N of one, but again, when we do these studies where volunteers are susceptible to sleep deprivation, we keep them up overnight. A great study just came out, a really, really high dose, but they were able to maintain memory and cognitive tasks after a night of no sleep compared to those on placebo. So there is something there. It will be nice to look at these big clinical trials to see the effects over time, for sure.
I'm interested too. I notice when I take creatine every day, whether I'm resistance training or not. But certainly, and we'll get to we'll get to if there is an anabolic window, we'll get to exercise in just a moment. But what I notice is that when I don't take, like, let's say I forget for whatever reason, I wake up more. Like I will wake up overnight. So I don't know if you've been talking about anti-inflammatory. I wonder if there's something to do with some of the counter-regulatory hormones that start to kind of spike, middle of the night, 2 to 4 o'clock is usually the time where my eyes will pop open.
Yeah.
So I wonder if there's some mechanism. I mean, I'm just
Yeah.
spitballing here, but that's what I notice when I take it regularly. Muscles are saturated. I'm performing well. I'm resistance training. I don't wake up overnight. So that's another thing a lot of women will complain of. It's like I can initiate sleep, but I can't maintain it. There's multiple wake points overnight. So that'll be another. I don't know if you're planning on looking at that, but that would be interesting for me to know if there's something there.
Those are all excellent questions. We just don't know. I mean, glycine is highly involved. I mean, it's derived from making up creatine, highly involved in sleep.
Yeah.
But what I tell people is if you're worried about, just take your creatine in the morning. Don't take it through, and maybe that'll no different than having coffee late in the evening. You might have some greater effects, but I think that's going to be a main primary dependent variable, sleep or indices of that moving forward.
Okay. So let's just because we're here, let's talk about, we've already been dancing a little bit around dosage. So, something around 5 grams if we're thinking about muscle performance, 10 grams if we're thinking like somewhere between 8 and 10 if we're thinking about muscle and bone. And then if we are looking for some of the brain benefits, is it a recommendation of like somewhere between 10 and 20? Is that correct?
Yeah, I think the best way to do it, let's say if someone's listening, they've never taken creatine, I think you start as little as 3 grams a day for the first week or so. See how you like it, things like that. Move your way up to 5, and then, after a couple months, move your way up to 10. I'd be shocked if you need more than 10 grams a day, because that is a dose. When we use MRS, the study, Paul Duchenne was the landmark author, and they showed 10 was fantastic for increasing our brain creatine stores as well. If you do the 20, it's probably really effective, but you may run into adverse effects. And with that 10 grams, I take 5 grams in the morning with breakfast, and I put 5 grams in a water bottle and I drink when I'm on the Peloton or lifting weights. So I don't take it as a single bolus. You can, but I just divide it up to get a little bit more frequent. But we're looking at studies now, do micro dosing of creatine to the same volume have any advantageous effects over a bolus? And those studies should be coming out soon. But if you look at the way creatine peaks in the blood after a couple hours and it stays there, it might be advantageous to split up a higher dose. So for example, if you take 5 grams, you can divide that up in maybe 2.5 gram dosages. If you insist on taking 20 grams, those are always 4 by 5 gram dosages. So you can take it in one lump sum or divide it up. We just don't know if one way is better than the other. But only probably individuals that are born with creatine synthesis deficiencies would they need a lot. I think 10 grams is a very viable saturating dose. Yeah.
Yeah. And I like that you're talking about sort of splitting the dose in the same way that you don't have 130 grams of protein at breakfast.
Yeah, exactly.
You could, but you're going to sort of spread that. I mean, that's sort of usually a target for a lot of women is somewhere between 130 and, whatever, 100, but you're not going to have it all at breakfast and then just have carbs and fat for lunch. You're going to sort of split it up over the course of the day.
And one thing I forgot, as you mentioned, I used to recommend, hey, you may only need creatine on the days you work out. Now I recommend to take it every day from the brain benefits.
Yeah.
The thought is on the days you're not in structured exercise, for example, try to maintain the consistency, and hopefully some of that creatine will be trickling into your brain. And then over time, it's another way to accumulate. Yeah.
Yeah. And it's just easier to anchor it to something that you're already doing. If you have it, you open up in the morning, you have your pantry, you take your supplements, it's there, you take it, you just don't ever forget, right?
That's correct. I agree. Yeah.
There was one Instagram post that I did that actually initiated me reaching out to you and wanting you on the show. I was like, this is what I do in the morning, talking about anchoring habits. I would put a scoop of creatine, coffee, I think I put collagen in that, and I sort of blended it all together. Yeah. And I didn't intentionally mean to do this, but it was just like this storm of people like, oh my gosh, at Dr. Karen, at Dr. Darren Candow, I can't believe you're denaturing it with the heat and da-da-da. So can we talk about, and I was like, what? Am I doing it wrong? Oh no. So is there evidence to suggest that heat will denature creatine up? I mean, I'm sure that it must at some point. So talk to us about heat. And then I have another question about coffee as well.
Yeah.
Or caffeine.
Yeah, high temperature or low pH will denature creatine into creatinine, but it needs to be there for an extended period of time. So if you're just dumping your creatine in your coffee and drinking it, and we'll get to the I'm sure the caffeine question there, but to answer your question, yes, heat, boiling water will have no denature the effects of creatine there. The ironic thing is creatine could go through the hydrochloric acid in your stomach and be intact, but heat is one thing there that can lead to unstabilization. Yes.
So at what is there a temperature that we know? So is my coffee doing that? So am I doing it wrong with the coffee?
No, I think what they meant was it wasn't the temperature, but there is evidence to suggest that caffeine. So again, a lot of people hear me say caffeine and they're thinking coffee. Caffeine and creatine, they oppose each other at the sarcoplasmic reticulum. So one allows calcium to leave, the other allows calcium to be taken back in. It's like a tug of war. But when you look at the data, it really reduces relaxation time at high caffeine dosages. And the dose that seems to have the potential interference, and again, there's only 5 or 6 studies that have shown this, is that when you do creatine and caffeine over 250 milligrams or more, there seems to be the potential for interference. So how much caffeine is in a K-cup? 80. How much is in a large Tim Hortons? Probably 300. You might get a bit more in Starbucks or Second Cup. So we don't know for sure. We're actually doing this study now in Iowa where we're looking at graded dosages of caffeine. I think it's the dose of caffeine that has the best evidence to suggest there's a potential interference. But if you put your creatine in your cup of coffee, which is probably no more in a cup of coffee, 80 to 100 milligrams of caffeine, I am totally fine with that. I'd be shocked if there's any interference effect. If you put your creatine in a large Starbucks that has 400 milligrams of caffeine and you're sipping on that for hours, there is a potential for degradation of creatine to creatinine, and it may not be as effective. It might be 90% as effective, but it may not be 100%. If you're not noticing anti-blunted effects, you're like, hey, I've been doing this for 6 months and I don't notice any benefit. You're either a non-responder or there's a potential of an interference effect. We don't 100% know, but the best cellular evidence out of Europe shows that, yes, there is a potential interference at high dose caffeine.
Okay. So we can just move it from the coffee if we're concerned about it, or you're not seeing some of the benefits that we've been outlining today, into your pre-workout, or, you're sipping it while you're working out, or in the evening with maybe not with your tea. I was going to say something, but you can just move it into just like water. You could just have, good old plain water.
Absolutely. But I think if your consistency is, hey, instead of putting sugar in your coffee, I put my creatine,
Yeah.
I'm all for it because you're probably getting the benefits. You'll know yourself if you're not getting any improvements in muscle endurance or strength. And again, it probably takes me 2 minutes to drink a cup of coffee. That's not nearly enough time. But if you're sipping on a large coffee all day long, heating it, reheating it all throughout the day,
Right.
that's when you might get an interference effect. But we think it has to be a pretty high dose. I will say we did a very small study during COVID. It was really underpowered. And it was the first study to look at creatine and caffeine powder together. And they seemed to have a blunting effect compared to creatine by itself. So they did weight training. And again, there is now, it was underpowered. But when you did run the stats, the creatine only group had a greater increase in muscle thickness compared to the creatine and caffeine group. They didn't have a detrimental effect. It just wasn't as high of an increase. So I never put my creatine in my coffee. I just put it in my breakfast or I drink it in water during workout. But I hear time and time again, it's probably the second biggest question, I guess, next to baldness. Well, if I put my creatine in my coffee, and of course people look at me and they look at other researchers, so like it must cause baldness.
Like evidence, there's the evidence for hair loss.
Exactly.
Yeah.
But if someone says, hey, you know what, this is the only way I'm going to maintain it, I'm like, all for it. Go ahead. Yeah.
Okay. So we think caffeine and creatine oppose each other. On the flip side, are there things that augment it, that bring it, like, is it their electrolytes, carbohydrate? Like, what should we be consuming with creatine to help the water we've already talked about? But is there anything that we can help the cells take it up?
Yeah. So the best thing is it doesn't even have the number one thing is not even a nutrient, it's exercise. So for those, hey, I don't need to do carbs or protein. Exercise will stimulate blood flow. It opens the doorways to our muscles, and therefore it augments creatine uptake. So you can now take creatine in the morning before you work out, drink it during your workout, after. The timing of creatine is irrelevant. In addition to exercise, there are two macronutrients that really seem to stimulate creatine uptake. One is carbohydrate. So that will release insulin, very similar that we understand for glucose disposal. However, the dose that seems to be shown to be the most effective is 90 grams of carbohydrate or more. And with the health consciousness of society and some of that carbohydrate is probably high glycemic, a lot of people don't want that. Good news, whey protein is very insulinogenic. It likes to release a lot of glucose and insulin. So if you can combine creatine with protein, and there is evidence to suggest they provide a synergistic effect, you get all the benefits of protein. You may get some added benefits of creatine. So when I put my creatine in my Greek yogurt, I also put whey protein and collagen in my breakfast with blueberries. I just had that. So that's about 60 grams of protein. It's about 5 grams of creatine. I'm probably getting an insulinogenic effect to my body because I usually work out in the afternoon. And then again, I drink my creatine during my workout. That's how I do it. Is very simple. But exercise, and then carbohydrates and protein. We don't see any augmentation with omega-3 fatty acids yet or fats. Electrolytes or minerals haven't really been shown to have any promise, but there might be other supplements that have derivatives of those products in there. We now know there's great benefits from beta-alanine and sodium bicarbonate in combination with creatine, but to get an increase in intramuscular creatine, we don't know. And we're really failing on seeing how much creatine will get in bone cells because we can't do a bone biopsy. So a lot of researchers stay away from that as well. So I'm always for exercise. Hey, drink your creatine or take it whenever you want. It's unlike caffeine. You don't need a timing effect. That's a good luxury. And now a lot of people have come up with travel packs and gummies, whatever you want to do to take it. If it's a viable source of creatine, it should be very effective.
And with the protein, so I actually think, first of all, I think that you should be having carbohydrates before you lift. That's just my personal bias. I think it augments performance in the same way that creatine might. But the protein itself does the type quality, is it, you mentioned whey.
Yeah.
Is it a dairy-based protein that we're looking at? Is it, can a plant protein like a pea protein or a soy protein, can those help as well? Is it, ubiquitous across all types of protein, or are we talking specifically about whey and animal-based proteins?
You have a great mind because I was thinking the same thing, especially with collagen is a big rage. So we only know the effects of whey, and that's probably because it's the most popular, it's the most insulinogenic, and it gets in the bloodstream really quickly. But we don't know the effects of creatine in combination with casein specifically, or pea or other plant proteins. That would be a great master's or PhD dissertation to look at the effects of creatine in combination with different proteins. My guess is it would be beneficial. It certainly won't be detrimental. Yeah.
We should get Simon Hill
Yeah, that's right. Exactly.
involved with that. I'm sure he'd be happy to look at that. You mentioned that you sip creatine while you're working out. One of the big questions, we talk about the anabolic window for extra, like we used to think you had 15 minutes to get that shake in, or else, the muscles were going to close, they weren't going to listen. Is there any type of, this might be a redundant question, you might have already answered it in different ways, but is there an anabolic window for creatine?
There technically is not. The best evidence does suggest that post-exercise creatine has a slightly greater benefit. But when we've looked at young and older adults comparing creatine before versus after, we don't see any effect. We did do a single study in young individuals looking at creatine during your weight training session compared to placebo, and it really augmented strength. And my graduate student is literally doing this study now where he's looking at the effects of creatine before, during, and after exercise. We're going to combine different data points compared to creatine on non-training days to see finally, does the timing really matter? If creatine only consumed on non-training days is just as effective, we now know that maybe muscle contraction is not even needed. So we're really looking forward to those data coming out next year.
Oh, I can't wait for that paper. That's going to be exciting. You mentioned hair loss.
Yeah.
And if there's two things that women are concerned about, bloating, am I going to get bloated? Am I going to lose my hair?
Right. Okay.
And I've had people comment on Instagram because I talk about creatine all the time. It's one of my favorite supplements for women, especially in perimenopause and in menopause. And I've had several women say it made my hair fall out. There's studies that, indicate that it increases testosterone and thereby DHT, and therefore, suffocates my hair follicles. So can we talk a little bit about whether or not that holds any water? I know that there is a study that was done, but maybe you can outline that. And then, have there been systematic reviews or other literature that can demonstratively show that creatine causes or doesn't cause hair loss?
Yeah, it's probably the number one myth or the number one unsubstantiated claim. So it was done in rugby players of South Africa over decades ago, where they simply did a loading phase, but it was a crossover design. So these same group of individuals took 7 days of creatine at 20 grams a day, slightly even higher, I believe. And then they measured a bunch of performance variables, including a hormone called dihydroxy testosterone, which is a precursor from testosterone. And it's been linked not in the cellular perspective, but of course they measured it in the blood serum, which has no correlation to hair thinning or follicle loss. In this study, they did not measure any cross-sectional area of any of your hair fibers or baldness, so to speak. But when they were on creatine, this hormone did go up compared to when they were on placebo. And this is an important distinction. When you go to your doctor and they measure blood glucose, cholesterol, there's a range. There's a low end and a high end, and it's the reference range where you fall in the population. And lo and behold, this hormone did go up, but it was still within the normal physiological range. And everybody took that to say, oh, correlation is causation. That hormone went up. That must mean I'm going to go bald. Not a single hair fiber was ever measured. There actually is a study going on now in the Middle East, I believe, where they're actually measuring through dermatology a cross-sectional area of the scalp and looking at hair number and quantity. And so I'll be super interested to see the effects there. I hear this all the time. People look at me and say, well, obviously you take creatine, that's affects. When you look at the maternal genetics from how you get baldness, we're not seeing any evidence. But since no study has measured it, scientifically, we have to say we don't know. No study's ever measured it. We just know that that hormone is not correlated. But just as important, there's no evidence to suggest that creatine leads to baldness. And I answer it also this way. I've assessed over 1,000 people. Half of those individuals were on a high dose of creatine. Not a single person has ever come to me and say, hey, Darren, whatever powder I'm taking is causing my hair to thin out. So for anybody listening that's worried about it, there is zero evidence that creatine causes baldness currently today.
Yeah, and I'll put this in the show notes as well. This was a 2021 systematic review of studies found that the current body of evidence does not indicate that creatine supplementation increases total testosterone, free testosterone, DHT, and or causes hair loss and baldness.
That's right. And that's a study. I put that group together for the myths and misconceptions, and we have part 2 coming out. But that was there right with kidney failure.
Oh,
And
yeah.
then bloating, it's right up there as well. Yeah.
Let's talk about kidneys. I hear that one too. It's like, isn't it bad for your kidneys? It's like protein is bad. It gives you kidney cancer and gives you cancer, and so does creatine. Like, it's so funny because it's like if someone has this is just my little rant here, but you can go to McDonald's and have like a Big Mac and fries and a milkshake and like whatever. I don't even know what their menu is now, but like whatever that is, no one bats an eye. But if you're like, I'm taking protein powder and creatine, people are like, kidneys, hair loss, death. It's like, all right.
Same individuals out drinking 6 beer a day and smoking a pack of cigarettes. So
exactly.
This is all the basic physiology. So when you take in creatine, it gets trapped in our cells, but when it's metabolized, it doesn't leave our cells as creatine. It leaves our cells as a byproduct called creatinine. And that's the thing that's on your blood requisition form because it helps estimate kidney function. So you also, right below it has eGFR, so glomerular filtration rate. Estimated because we never want to take the time to do the real one.
Yeah.
And whenever someone's taking creatine, I always recommend to let your nephrologist or GP know you're on supplementation because it's likely that your serum or blood creatinine levels will be high. Because if you have more creatine in the muscle and you're working out or whichever, the creatinine should be higher. And if it is, that usually means it's a false positive because if your creatinine's higher, that means your kidneys are not filtering. It's like your Brita and your water filter. And 9 times out of 10, when they go and their doctor says, oh my God, your kidneys are in distress. What are you taking? I'm taking creatine supplementation. They immediately say to stop, obviously to err on caution and medical liability. And usually when those individuals say, okay, go off creatine for 4 weeks, their numbers come back to baseline, clearly showing their kidneys were fine. It was just the metabolism of the supplement. So for those listening, if you're on creatine supplementation and you have your annual physical coming up, your creatinine might be a bit high and therefore your GFR might be a bit low. That may not necessarily mean that you have impaired kidney function. And study after study after study, we've done long-term, clearly showing that creatine has no adverse effects on any of the kidney or liver enzymes.
Yeah, great. Let's go through a couple more here. Does it cause cancer?
No, it actually has been shown to have some anti-cancer properties. That's been shown in lower doses. We actually have part 2 of the study coming out. There's some implication now with barbecue or char food having some increased incidence of gastric cancer, but from creatine having a pro-cancer effect, we're not seeing any evidence there. We're actually seeing the opposite of anti-cancer effect as well. So this part 2 of this myths and misconception paper is coming out soon, and we focused that section along by Mark Tarnopolsky at McMaster, one of the world's best medical doctors, and he's looked at all the research, and we've narrowed it down that we're not seeing any of the effects.
Yeah, this is one of the papers that I actually used to prepare for this. So we'll make sure that that's in the show notes as well. And is the anti-cancer properties, do we think that that's related to the anti-inflammatory properties? Is that what we're thinking?
Yeah, we're thinking it's the anti-inflammatory or the reduction in reactive oxidative species or oxidative stress.
Yeah.
And this is good because one thing we haven't talked about is what about all the aerobic and endurance athletes out there?
Oh, yeah.
Or creatine was only beneficial for the weight room. And we've now shown that creatine has aspects for soccer, swimming, or aerobic type of sports, primarily long duration. It seems to decrease cytokines or markers of inflammation. And therefore, overall, creatine seems to have these anabolic or anti-inflammatory effects. So for those involved in aerobic exercise that often gets left out, creatine can have some advantageous effects there, primarily from a recovery aspect.
I'm so glad that you said soccer because that reminded me of my boys. So my both sons are playing competitive soccer. My 13, almost 14-year-old now, very into the weights. I think it's because he's kind of getting into girls, but I think but hitting the weight room, right? And one of the things he started doing is so his coach, he has a coach that whatever, makes a program for him. And his coach was telling him, take more protein and make sure that you're taking more creatine. And I was like, thank goodness that we have a coach that's not saying you can't squat, muscle, weight training is going to stunt your growth, like none of that. So talk a little bit. I actually wanted to bring this up around children, because we've been talking a lot about young males and the studies around, menopausal women and perimenopausal women. But can we also now, as the women who are listening, primary caregivers for their family, is this something that we can think about for brain health, bone health, muscle health for our children as well?
Yeah. Currently, the body of research primarily out of the US is clearly showing that creatine is safe at recommended dosages, the 3 to 5 grams a day, safe and very effective from a sports or performance perspective. Chad Gersick and Yan Yagom are the researchers of the US that really lead this way. And they're actually currently looking at blood biomarkers, which is great to look at the safety profile. And hopefully those results will be coming out soon. But there's been a study done in concussion in children in Scotland. But overall, creatine is safe and effective from a subjective standpoint for children, and that includes adolescents. And the reason being is since children are naturally synthesizing this, they're getting it in their diet when they eat chicken or seafood or red meat. That's probably why the safety profile is very, very high. I would be shocked that when the blood panels come back if there's any adverse effects.
And at the beginning of let me just go back to my notes here. At the beginning of our conversation, you were saying that we probably have a net accumulation of somewhere between 2 and 3 grams. That was an adult. Is it still the same 0.1 per kg for kids too, in terms of what the dosing might be for them?
Yeah, it's probably a little bit lower depending on their diet. I mean, when I was a child, I didn't like, red meat or seafood, you eat whatever was given, but it depends on their diet. But at most, maybe 1 to 2 grams is coming in through their diet. They're synthesizing about 1 to 2 grams as well. So their net accumulation could be anywhere between 2 to 3 grams, which is super small. That's 1/8 of a teaspoon. Yeah.
Yeah. Okay. So we can be thinking about, well, my son actually just does because the scoop in the creatine monohydrate comes with like a 5-gram scoop. He's just doing that. So I didn't even think I should split it. He just does that in his protein shake.
That's easy to do. Very easy. Yeah.
Yeah. And he's bigger than me right now. It's like 5'11". But anyway. Okay. So creatine, good for kids, aerobic and endurance sports as well. What about injury? So you just mentioned concussion, and I used to always recommend creatine for my concussion patients when I had my clinic, in terms of sort of the metabolic derangement that can happen at the level of let's say the joint or cartilage or muscle, or if you have a concussion and we have brain tissue that's injured. How can we use creatine to help augment that healing process?
Yeah, so the research is pretty much equivocal on the benefits of creatine after surgery, so ACL surgery or things like that. But the thought is maybe if I know I'm going into surgery, maybe I take creatine in addition to my pre-surgery workout to try to maximize strength performance and some of those cellular aspects so that when the knife goes in or whichever the laser and it has those catastrophic effects to the cell, it might be able to recover more. And it's the same line of thinking when we look at that single study in children with concussion.
Yeah.
When the individuals were suffered head trauma, and they took creatine, it seemed to speed up the rate of recovery. So again, it's not going to prevent anything, but there's been a few studies to look at surgery. And then we did a study at St. FX University in Nova Scotia a few decades ago where individuals who were healthy volunteered to have a plaster cast put on their arm. So they were immobilized, and creatine really preserved the rate of muscle strength compared to placebo or the non-fractured arm or dominant limb. So there is evidence that even during immobilization, creatine can have some favorable effects. But there's been a single study by Peter Hespel out of Europe where these individuals went through rehabilitation exercise after immobilization, and creatine seemed to increase the rate of recovery in a few instances. So there is some evidence to suggest it. In my opinion, if someone was going in for ACL surgery or whichever, and they were exercising, I would recommend or emphasize maybe take creatine before and again after. It could have some beneficial effects. It certainly won't have any jeopardizing effects.
Yeah, and part of the, if you're injured, let's say you have a muscle strain or, you've sprained something, you still want to be like we've talked on the podcast before about maintaining protein. So you still want to maintain protein to drive that MPS because you can't right now have that mechanical stimulus, let's say at the gym. Yeah. The same is true here. So you want to still have that protein to be driving that MPS, and then the creatine for that anti-catabolic effect and the anti-inflammatory effects that we've been discussing to help with that progress.
And I'd love to look at studies with fracture. If you suffered a fracture, could that really help improve collagen matrix? So the thought with the creatine study,
the chondrocyte activation.
I was thinking with the big push on collagen, where it doesn't have a lot of bang for its dollar from a muscle protein synthetic perspective, but if you had creatine and collagen from the anti-catabolic effects to bone, could that have applications for fracture prevention or those that do suffer from a fracture, osteoporosis? So these are studies that need to be done. They're very expensive, but I think down the road they will eventually come out for sure. Yeah.
If you had a dream study, like everything was funded, you didn't have to, you're going to get all the funding that you wanted, what study would you do?
I would look at the longitudinal effects now from children all the way up to frailty, look at the effects of creatine with continuous exercise on indices of muscle, bone, and brain, and see kind of have these total body effects. The big study that I've talked about on a few other podcasts, there's a lot of nonsense out there with the GLPs right now and the excessive weight loss. And then I'd say, well, obviously, if you're having a lot of weight loss, some of that will be lean tissue. Yeah. If you took creatine and protein and weight training, maybe you maintain all that lean tissue and you get accelerated weight loss, but that would cost millions of dollars to do. And these drugs are potentially saving people's lives. So it's kind of something to add on over time. Another area is for pregnancy for the females. Stacey Ellery of Australia is now looking at greater fetal development and energy status for the female. So it's interesting how it's now looked at for pretty much anybody on the planet could consider this. They're already naturally synthesizing it, but I would love to look at the epidemiological study of creatine across the lifespan and see the effects in childhood, adulthood, and could something early on in life, what always gets often overlooked, could that make people live longer free of disease? Why would you want to live to be 180 years of age, the last 20 years, really immobilized and you want to live robust and be functionally independent? And I think exercise is the foundation. Protein and good carbohydrates are the icing around the cake. Maybe creatine is the sprinkles that go on top just to give a little bit more flavor. But exercise to me is the fountain of youth. I don't think anything will ever replace it. But sadly, most people don't even exercise. So I think we got to get that out there first and then talk about proper nutrition.
Yeah. This has been so informative, so valuable. If people want to find out more about your work and your research, if you're recruiting for studies, exactly. Tell people where they can find you and your work.
No, thank you again for having me. I think at Instagram, at Dr. Darren Candow is the easiest. They can message me if they have any questions, or I usually try to post about the current up-to-date research, not just on creatine, but things that promote healthy living and healthy aging specifically. And again, thank you so much for having me.
Thank you. This has been wonderful.
Great. Thanks.
All right. I hope you enjoyed today's episode. And I must give you the obligatory legal and medical disclaimer here. This podcast, Better with Dr. Stephanie, is for general information only. And the advice, recommendations we discuss do not replace medicine, chiropractic, or any other primary healthcare provider's advice, treatment, or care. In the consumption of this podcast, there is no doctor-patient relationship that has been formed, and the use and implementation of the information discussed are at the sole discretion of the listener. The information and opinions shared on this podcast are not intended to be a substitute for primary care, diagnosis, or treatment. In other words, guys, be smart about this. Take it with a grain of salt. Take this information to your primary healthcare provider and have a discussion with him or her to make the best choice that is for you. Remember, I am a doctor, but I am not your doctor, and these conversations are meant for educational purposes only.